Hello, everyone. Welcome to LUMP, TCM, and Acupuncture Basics. Let's start the ball rolling with the first presentation, Excess States, Part 2. Okay, let's talk about the mother-son cycle. The organs of the 5 elements send energy to each other in a clockwise direction. Just like water nourishes the growth of trees, the wood, and wood is needed to make a fire, the organs of the water element nourish that of the wood element. Now, the kidney nourishes the liver, and the urinary bladder nourishes the gallbladder. So yin nourishes yin, yang nourishes yang. There are 2 parallel circles, one between the yin organs and another between the yang organs. It would be better to call this father-son cycle and mother-daughter cycle. Unfortunately, in old China, as in the new, a male child was precious, but a girl would not carry the family name and was considered an it. So we refer to the parent always as the mother and the child always as the son. How do we use the mother-son cycle? Let us suppose that in a patient, lung yin was deficient, and the patient had thin and dry skin, dry nose, and throat. We should advise the patient to drink more water and humidify the rooms with houseplants and water containers on the radiators. We can also tonify the lung yin with acupuncture. So let's talk about tonification on the mother-son cycle. In the mother-son cycle, there are 2 reasons why the spleen does not nourish the lung. One reason is that the energy flow between the mother and son is blocked. This is remedied by reinforcing the flow, by giving the earth point of the lung, which is lung 9. Lung 9 is called the mother point of the lung, as it receives the energy from the mother organ. By doing so, we have simply unblocked the energy flow between the lung and its mother, the spleen. Every organ has a mother point. It is the point that receives energy from the mother and is the best tonification point of that organ. So when the mother point of a yin organ is used, the energy flows in from yet another yin organ. All yin organs have more yin than yang energy in themselves. And so the energy that comes in will be more yin and little yang, like 90 is to 10. But when a yang organ is tonified, the energy that comes in will be more yang and less yin, like 90-10. Okay, let's do some working exercises. How will you treat acute gallbladder colic? So excess, so we need to sedate. Sedate gallbladder yang directly using sedation point gallbladder 38. What is your treatment for tachycardia? So we need to sedate the heart yang indirectly using SI8. So we sedate indirectly over SI8 sedation. What point will you use for acute cystitis? So this is urinary bladder, so we excess. So we sedate directly with bladder 65. How would you sedate kidney yang in kidney colic? Sedate indirectly over urinary bladder with bladder 65. So we sedate using bladder 65. We sedate indirectly. Where does the energy flow to when sedation points are used? And where does the energy come from when tonification points are used? The mother point or tonification point will always work well, provided the mother organ has enough energy. But if the patient is thin or malnourished, the spleen is also weak. It is then possible that the respiratory organs and skin are dry and poorly nourished because the mother organ has less blood and yin to send to the son organ. If we find that both the mother and the son organs are deficient in yin, there is no block between them. The cause for both deficiencies is deficiency in the mother organ. So it is then possible to tonify spleen yin and change to a diet that would improve the spleen nutrition. And the increased energy from the mother would automatically flow to the son. Thank you very much for your attention. We now listen to Sir Dino Pinheiro of Legazpi for the second presentation. He will talk about the miscellaneous pathogenic factors. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we continue with the miscellaneous pathogenic factors. First, we have too little food. Eating disorders are very common among younger patients, and it is always a good idea to find out about their eating habits. Some of them live in a cereal bar and an apple all day. For others, raw carrots or fruit is their sole source of nutrition. They actually look surprised when told that this is not a balanced diet. Example, we have a female 34 years old. The patient was a company director, slim, and complained of a chronic headache for the past 5 years. The pain was in the entire forehead and came on nearly every day. Although it was somewhat better during holidays, it started in the early afternoon and increased by the evening. She vomited often, which did not help the headaches. Some evenings, the headaches and vomiting were so bad that she had to retire to bed without dinner. She had noticed that if she ate something at the onset of the headache, she might be able to stop it. However, after the headache became worse, only tablets would help. So now she took a tablet every day before the headache got worse. True, it is easier to take a tablet than have a meal. I asked her about her eating habits. She had a cereal bar in the morning, a leafy salad and or apple for lunch, and a warm meal in the late evenings. She missed this meal on several occasions because of the headache and vomiting. During her midday break, she sometimes went to the company gym to do aerobic exercises. Who said that poverty is the only reason for starvation? It could be ignorance, vanity, or perhaps the fact that a doctor should prescribe food as therapy for a patient to consider taking it. I took the patient's weak pulse at her cold wrist, looked at her pale tongue, and told her that the headaches in the forehead are generally associated with the stomach. Her headache could as well be a problem of the stomach. Had she considered that she may have a low blood sugar at these times? She looked surprised, but she said that it sounded logical, especially as the headaches went away with eating. We decided that she would have many small meals during the day, but most importantly, she would start her day with a warm breakfast. As advised, I advised her to do some neck stretches during the working days in order to relax. I treated her only once. Her headache disappeared. Too little food in quantity and variety will reduce the nutrition sa blood to the spleen and stomach firstly, and then to the entire body. This leads to blood deficiency, nutritional deficiency, and loss of weight and structure, which further lead to loss of functional energy and endurance. So sa treatment, There is nothing in the world that can replace food. One could treat low appetite of malabsorption following food with acupuncture. And it is important to educate our patients about the importance of a balanced diet with regard to variety and quantity and time of day. So we have points to improve appetite, points to tonify stomach yin to work better. First, we have REN 12, the mook point of the stomach, spleen 21, the major loop point of spleen, PC6, the distal point, and the stomach 43, grandmother point to tonify yin. Small and tasty meals frequently rather than large meals. Points to improve absorption of nutrition. Nausea after meals, not vomiting, is a spleen qi deficiency symptom. So ang points, we have UB20, which is the bakshu point, stomach 36, PC6, spleen 6 will help along with some light moxa on run 12. Diarrhea after meals could be spleen or small intestine qi deficiency. It depends on how soon after eating and where in the abdomen the patient feels discomfort. If the symptoms is from the small intestine, the discomfort is around the navel. And in the case of spleen, all over the abdomen. Points to improve small intestine function. First, we use UB27, which is the bakshu, stomach 39, the lower C point of small intestine 7, the lu, with some light moxa on the navel, point REN 8. Thank you po for your attention.
Thank you very much, Sir Dino. We continue with Shen. Let's talk about Shen. If the tongue body color is pale or pale red, the stomach yin can be regenerated within weeks or months. So we're talking about the disappearance of the tongue coating, provided the diet has been rectified. If the tongue signs appear with a red tongue body, it indicates stomach and kidney yin deficiency, suggesting that the healing process will take longer. Let's now take up this 22-year-old male case, another case. Tongue is pale red, slightly swollen sides. You notice some small cracks at the center of the tongue. Then we have a dry center without coating and yellow thin coating at the posterior third. Patient complained of severe itching of the skin, appearance of damp red skin lesions, no appetite, feeling of fullness after eating, soft smelly stools, night sweats, inner restlessness, depressive moods. Western diagnosis is atopic eczema. Background to disease, family history of eczema, alcohol and caffeine abuse, long-standing emotional problems. So TCM diagnosis, spleen qi deficiency with accumulation of dampness, onset of stomach yin deficiency, and slight retention of damp heat in the lower burner. Next, we have a 37-year-old male whose tongue is described as red, wide, and thin, with peeled red and cracked center. The edges are curled up and slightly swollen, and the tip is reddish and curled down. Coating is yellow, slightly thick, with red points at the root. Symptoms: constant headache, migraines, inner restlessness, occasional stomach pain, smelly loose stools. No Western diagnosis. Background to disease: trauma, sustained fracture of the skull 2 years ago, alcohol abuse in the past, excessive consumption of spicy foods, and emotional problems. So TCM diagnosis: there's injury to fluids due to heat, stomach yin deficiency with heat in the stomach, liver qi constraint with heat in the liver, and the tip pointing downward, and it's red. There's heat from deficiency in the heart and accumulation of damp heat in the large intestine. As you can see, there are red spots aside from the slightly the yellow tongue coating at the posterior third. Next, we have a 54-year-old female whose tongue is described as pale red and swollen, with thick greasy coating on the left side. Coating without root, so we have a rootless coating, deep crack in the center with yellow greasy coating. Symptoms: loss of hearing in the left ear, tinnitus and earache, panic attacks, inner restlessness, nervousness, dizziness in the morning, headaches, insomnia, and occasional night sweats. Western diagnosis: acute loss of hearing. Background: excessive demands at work and emotional problems. So the TCM diagnosis, we have spleen qi deficiency with accumulation of dampness, accumulation of damp heat in the liver and gallbladder, and stomach yin deficiency with accumulation of phlegm fire in the stomach. Next, we have a 66-year-old male whose tongue is described as red and the shape is firm. Coating without root at the center and root. Yellow old coating. Symptoms: severe constipation, heartburn, stomach pains, extreme physical weakness, night sweats, pain in the bones. Western diagnosis: prostate cancer with metastasis to the bones. Background to disease: overwork, emotional problems. TCM diagnosis: stomach and kidney yin deficiency, accumulation of damp heat in the large intestine. And then we have the 32-year-old female whose tongue is described as pale red and swollen, with red, big, slightly raised points in the anterior and middle thirds, yellow slippery coating. Symptoms: swollen red tonsils, frequent sore throats, frequent otitis media, irregular menstrual cycle. Western diagnosis: chronic tonsillitis and habitual miscarriages. Background: overwork and emotional problems. Chinese diagnosis: spleen qi deficiency with accumulation of dampness, toxic heat lodging or festering in the upper burner, and accumulation of damp heat. Finally, we have the case of a 36-year-old female whose tongue is red with red sides, deep red points on the anterior third and sides, yellow thick greasy coating at the center and root of the top. Patient complained of sore throat with hoarseness, strong night sweats, insomnia, inner tension, flatulence, cold hands and feet. Western diagnosis: acute cold. Background: difficult divorce, repressed emotions, overwork, lack of sleep. TCM diagnosis: we have heat in the liver transforming into fire, toxic heat lodging in the upper burner, and accumulation of damp heat in the middle and lower burners. Thank you very much for your attention. We now go to the 5 elements, and we give you Sir Dino Pinero once again. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat.
Good afternoon po.
Now we go to the disease of the fire elements. Now the hypotension, the treatment, we use the symptomatic points: liver 3, do 26, lung 9, kidney 6, moxa, and UB 17. Sa first tower diagram, we have the liver and blood deficiency. The next is heart, blood, and qi deficiency. And the third tower diagram is the liver yang deficiency. Less blood, pale, and weak person. there is deficient blood pressure all the time, easily sleeping extremities, blurred vision, dry eyes, night blindness, craving for creamy food. There's long menstrual cycle, little bleeding, there's brittle nails, and contraction of tendons. Ang points na gagamitin is REN 14, UB 15, spleen 10, liver 1, liver 8, GB 39, and kidney 10. Increase in salty food and water. Sa liver yang deficiency, there is less tension in the vessels, flaccid muscle tone, lower blood pressure, mainly in the mornings. There is short or long-sighted, soft voice, low aggression, problems digesting fatty foods, premenstrual tension or dysmenorrhea at the onset of menstruation. Sa treatment, we use UB 18, GB 43, stomach 40, kidney 3, and LI 11. So, ang session po is one session weekly for 10 times. If blood deficiency is present, iron may be given orally. This problem is quite common in young girls. The liver yang and Qi deficiency type has very quick results after treatment. In addition, drinking the juice of half a fresh lemon each morning, so sweetening it with some honey if wished, is also effective. Now we have here the heart and small intestine. The first tower diagram, there is deficiency of blood with normal Qi. So sa mental capacity, there is decreased memory. Ang sleep needs much sleep, superficial, and disturbed sleep. Sa blood, there is decreased blood or pale. Ang sweat, little concentrated, may night sweating. Ang speech, little to say, stammering, hoarse voice. Sa second tower diagram, we have increased yin and decreased qi. Sa mental capacity, slow, dull, decreased creativity. Sa sleep, there is low alertness, sleeps off soon. Ang blood niya is decreased circulation cold. Ang sweat, no sweat siya. And sa speech, little speech, slurred, and deep voice. The third tower diagram, parehas po deficient ang blood and qi. Sa mental capacity, there is decreased concentration, decreased memory, and there is confusion. Sa sleep, always tired but cannot sleep. Yung blood niya, decrease ang blood, decreased circulation, sometimes hot, sometimes cold. Ang sweat, there is cold, increased sweating, mostly on face and extremity. Sa speech, talks much, says nothing, confused speech, there's weak voice. Sa fourth tower diagram, there is excess yin, normal po yung yang. Sa mental capacity, there is an excellent memory like an elephant. Sa sleep, sleeps very deeply and may sleepwalk. Sa fifth, we have excess yang and normal ang yin. Mental capacity, very quick, very creative. Ang sleep is restless, cannot fall asleep, has many dreams. Ang blood niya is increased circulation, red and hot. Ang sweat, increased heat and sweating. Sa speech, talk fast and a lot, high voice, excited. Next tower diagram, parehas po increase ang yin and yang. Sa mental capacity, there is very quick and wise. Sa blood, there is increased circulation, red and hot. Sa sweat, there is increased heat, increased sweating. Sa speech, there is compulsive communicator. Next tower diagram, excess ang yang, deficient po yung yin. Mental capacity, short periods of good concentration, decreased memory. Sa sleep, nightmares, superficial sleep, not fresh after sleep. Ang sa blood, mostly pale and cold, red suddenly in patchy areas. Sa sweat, there is increased heat, decreased sweating, strong smell. Sa speech, talks a lot, eloquent, less information, rough voice. Ang last tower diagram, there is increase in blood, decrease in chi. Sa mental capacity, dull, slow, introverted, lacks confidence. Sa sleep, there is hyperinsomnia, always sleepy, does not improve after sleep. Sa blood niya, there is decreased circulation, cyanotic cold. Sa sweat, there is decreased heat, there is decreased sweating. Sa speech, slow and hesitant, slurred, and deep voice. Thank you po for listening.
Thank you very much, Sir Dino. We now discuss the TCM causes of disease. Okay, so those who worry too much and think too much will have digestive issues. Or those with digestive issues will often worry and think too much. And if there is overexcitement, you will have insomnia and restlessness. So we're talking about the emotions in Chinese medicine and their effects on the physical body. So if there is anger, or if you're angry all the time, you will have headache and high blood pressure. And if you have chronic fear and shock, you can have fainting. And if you are sad most of the time, you will experience fatigue. Okay, so let's talk about each emotion in detail. So if you, in Chinese medicine, frustration and anger actually belong to the same category. So, and even resentment. So the organ involved would be liver or gallbladder, and the liver is the general, belongs to the wood element. And if there is excess of the wood element, there would be arrogance, you are judgmental, and you are full of resentment. Okay, so if you have a good amount of the wood element, you are flexible, you are patient, and you have humility. But if your wood element is deficient, you tend to be hopeless, you are full of indecision, and you are ambivalent. Symptoms of frustration or anger would be suicidal, muscle pain, anger disorder, and headache. Now let's talk about joy. The organ involved would be heart or the small intestine. Heart is the king and the house of Shen. Element, fire. Excess fire will make you manic, you're sarcastic and manipulative. If you have a good amount of the fire element, you are full of enthusiasm and optimistic. But if you are deficient in the fire element, there is apathy, you are joyless and flat. Symptoms of that the heart is affected, you will have palpitations and sleeping disorder. Next, worry or overthinking. The organ involved would be spleen or stomach. And spleen is the envoy. Element is earth. So if you have excessive earth, you are very obsessive, you are selfish, and you have a very overbearing attitude. Good amount of earth element, you're thoughtful, you're empathetic, you're full of empathy, and you're self-secured. If you are deficient in the earth element, you have this neediness and draining. Symptoms, IBS, throwing up, anorexia, gaining weight. Now let's talk about grief or sadness. The organ could be lung or the large intestine. Lung is the architect. Element is metal. Excess metal, there will be vanity, perfectionist. You are very dogmatic. Good amount of metal element. You are full of inspiration. You have self-worth. Deficiency in the metal element will you will have a feeling of emptiness, self-deprecation, frail longing. Symptoms: compromised immune system. And lastly, let's talk about fear. The organ could be kidney or urinary bladder. Kidney is the treasurer because it stores the essence. The element is water. If you have excessive water, if you have excess of the water, if your water element is excessive, you are phobic, you're paranoid, you are very vigilant. Good amount of water, you are full of wisdom, awareness, and prepared. Deficient water element, you are withdrawn and you fantasize a lot. So symptoms associated with the water element, if it's imbalanced, you'll have low libido pain, fertility or period issues, and gray hair. So let's talk about the job hazards in TCM. So if you happen to be working in a penal colony, so you'll have back and knee issues. Okay, if you have computer work or your clerical jobs, you'll have you tend to have a back and neck aches because you're always in front of the computer. Now, if you're a hairstylist, you'll have shoulder and neck issues. And finally, if you are a store clerk or you're a cashier, you'll have you're prone to have carpal tunnel syndrome. Okay. So what are the causes, possible causes of diseases in TCM? Extreme work pressure. So you should love your work or probably don't bite what more than what you can chew, no? So wag nating i-pressure yung sarili natin. Let's just do whatever we can and we should not force ourselves. Long studying hours. That's why we don't meet every day. Okay, so then another cause would be overworked, of course, and also overwhelmed. You have multitasking, especially if you are a mother who needs to take care of her child. So what are the methods to seek the cause of disease? So we seek the cause by syndrome differentiation. This is a characteristic of etiology in TCM. TCM studies the cause of a disease by understanding objective conditions that may become pathogenic factors according to the manifestations of the disease and through analysis of symptoms and signs of disease to infer its cause. Thank you so much for listening. Okay, let's continue with another topic. We will discuss the Zangfu organs. We will continue with lungs, functions of the lung. The nose is the outer orifice of the lungs. If lung qi is in harmony, the nose is clear, breathing is smooth, and the sense of smell works normally. When the lungs are affected by internal or external factors, example, wind dump, you will have common cold or rhinitis or chronic congested nose. The lungs nourish the skin and body hair and will protect the exterior against invading pathogens. That's why we consider it to be our sentinel, guards our immune system. No? So the lungs control the body surface. The lungs send and distribute defensive or wei qi outward to the body surface. Lungs nourish the skin and body hair by distributing nutritive or yin qi to the body surface. If the function of the distributing body fluids is impaired, there will be edema in the upper body. For example, face edema in the morning. The lungs are responsible for opening and closing of the pores and sweating. So if you sweat a lot, even if it's not hot, then there is a problem with our lungs. Lungs nourish and moisten the skin. So malfunctioning of the lungs will lead to dry skin. Application of cream doesn't solve the problem because the cause is internal. Impairment of this lung function can be the result of spleen weakness. Okay? The mother is deficient. Spleen, when weak, produces too much dampness, and this can accumulate under the skin. And pores are no longer permeable. The skin is dry on the outside, but moist internally. The lungs house the corporeal soul, the po. Corporeal soul is responsible for our instincts. The function of the corporeal soul is to enable body to move and perform its functions. The ability of a newborn baby to breathe, cry, and take milk is a manifestation of the corporeal soul. Corporeal soul gives us the ability to perceive instinctively. People with a strong corporeal soul, they have the ability to intuitively sense danger. Intuition not to board the airplane on a particular day originates from a corporeal soul that warns us of coming danger. So those people who can who have this uncanny feeling that something bad is about to happen, this is about having a very strong corporeal soul. Corporeal soul represents our future. Fear of the future or existential fears has its root in impairment of corporeal soul. The emotion of the lungs is sorrow. Powerful or long-lasting emotions can damage the qi. Sorrow is emotion that causes the qi to disperse. Okay, so it will become deficient. Sorrow affects lung qi. It is a healthy process to experience sorrow. For example, when we lose a loved one, separation causes sorrow, and it is necessary to experience it in order to let go. If we are not able to grieve, or if we have no time to grieve, this emotion affects the lungs. And when the lungs are affected, this will disperse the lung qi. So there will be hoarse voice, faint voice, or breathing difficulties. So if you have patients who have these issues, you may probably want to look into the past experiences of the patient. If the practitioner treats a patient with repressed sorrow and the lung qi is moved and tonified, the patient may respond with crying. This is a very important and healthy reaction which is needed in order to dissolve suppressed sorrow. So you have to have this ability to make the patient cry. The lungs are responsible for contact with our environment. If lung function is harmonious, we are able to have close relationships and we are able to protect ourselves if needed. It is important for a practitioner to protect himself in a healthy manner from his patient's problems. So now let's talk about the relationship of the lungs and the heart. Okay. Heart governs blood, lungs govern the qi. The blood of the heart nourishes the lungs. Thank you so much for listening. Up next is the Meridian theory to be discussed by Sir Gino Pinheiro.
Okay, good afternoon ulit. Now we continue sa urinary bladder meridian of the foot great yang. The urinary bladder meridians of foot great yang. The urinary, this begins near where the small intestine meridians ends at the inner canthus. The meridian then flows to the vertex, running parallel to the midline and going over to the occiput. At the occiput, it divides into two parallel lines to the midline and runs all the way down to the back to the legs. These two lines become one again at the knee, after which there is only one line that flows on the back of the calf and to the lateral side of the foot, ending at the lateral corner of the little toe. From this point, it connects up with the point kidney 1 of the kidney meridian. The inner branches meet point D20 at the vertex and enter the brain. At the lumbar region, it enters the body and the organs, kidney and urinary bladder. So first we have the UB2, ang location in a depression at the medial end of the eyebrow directly above the inner canthus of the eye. Point explanation, often a painful point in the frontal sinusitis and menstruation-related headache. Needle should be given at an angle either towards the nose in sinusitis or the eye kung may headache. Next, we have the UB10. Location, approximately 1.3 tune lateral to D15, where the trapezius muscle inserts on the lower border of the occiput, close to where the major occipital nerve emerges. Sa point explanation, a tender point in occipital headache should be needled high into the hairline. Points UB2 and UB10. When patients complain of pain from the forehead to the occiput, we find this to be a neck-related pain. This could be either on the urinary bladder meridian or it could be on a gallbladder meridian, as both these meridians flow in this area. Look for the tender points in these areas, concentrating on points UB2, GB14, UB10, and GB20. This would usually give me an idea as to which meridian is affected. Please bear in mind that both could be affected at the same time. But if you find that the UB points are more tender on pressure, these patients often have a history of backache and women often have painful menstruation. If so, this problem would need to be treated to alleviate the neck or occipital pain. Next, we have the UB11. This is located at 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the first thoracic vertebra. T1 with hanging shoulders on the level of the acromion. Point explanation, this is the influential point for bone. This point is used in musculoskeletal problems. Next, we have UB12, which is located 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the second thoracic vertebra, T2. Point explanation, this is a wind elimination point for the neck, lung, and skin. It is used in allergic asthma, skin irritations, and pains moving up and down the back. Next point, UB13, which is located 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the third thoracic vertebra, or T3. Point explanation, the back shoe point of lungs. From where we begin with back shoe points, these are points that are related to each of the 12 organs and are mainly used to improve their functions. The back shoe points are used with extra therapies such as cupping, moxa, and massage. Thank you po for your attention.
Maraming salamat po, Sir Dino. We now come to the last topic for the last presentation for this afternoon. Chest painful obstruction. We discussed the etiology. External pathogenic factors. External cold can invade the chest and it can obstruct the circulation of yang qi in the chest. The obstruction of yang qi will lead to chest painful obstruction with the ensuing feeling of oppression and pain in the chest. External cold is all the more likely to invade the body if there is a pre-existing yang deficiency. So may comorbidity na, no? In particular, a yang deficiency of the lungs or heart will predispose the body to invasion of cold in the chest. So for those people who have pre-existing heart and lung yang deficiency, there is always the predisposition to cold invasion, external cold invasion. The Methods and Rules of Medicine by Yu Chang, says, in chest painful obstruction, pain in the heart region is caused by yang deficiency and invasion of cold. The treatment planning according to syndrome categories by Lin Pichin says, in chest painful obstruction, yang qi of the chest does not move. After a long time, yin will take the place of yang. Now let's go to diet. Irregular eating and excessive consumption of fat, sweets, dairy foods, or cold raw foods injure spleen and stomach. As a result, this cannot transform food and transport food essences, and phlegm is formed. Phlegm obstructs blood vessels. So if the blood vessels are obstructed, there will be qi and blood stagnation. Blood stasis in the chest blocks circulation of yang qi in the chest, and this leads to chest painful obstruction. In chest painful obstruction syndrome, there is an interaction between phlegm and blood stasis, and as these two pathogenic factors aggravate each other. Now let's go to emotional problems. Worry, brooding, pensiveness, and shame injure spleen and lungs. When the spleen and lung qi are weak, after some time, the qi may stagnate in the chest. Prolonged qi stagnation may also lead to phlegm formation in the chest. Both qi stagnation and phlegm contribute to chest painful obstruction developing. Anger, resentment, frustration, and guilt injure the liver and prevent its qi from flowing freely. Liver qi stagnation may turn into fire after a long period of time. Fire burns body fluids and then condenses these body fluids into phlegm. Okay? So both stagnant liver qi and phlegm lead to blood stasis, and blood stasis will lead to obstructed movement of the yang qi. This causes chest painful obstruction. Old age, declining kidney yang will fail to warm the internal organs, and so this will lead to heart yang deficiency. Declining kidney yin will fail to nourish the internal organs and may lead to heart yin deficiency. So walang ligtas, okay? If heart yin is deficient, heart yang cannot move, and this leads to qi and blood stagnation in the chest and chest painful obstruction. In both cases, the root is deficiency of yin or yang of the kidneys and heart, and the manifestation is the stagnation of qi and blood in the chest. Thank you very much for listening, and hope to see you in our next presentation. Thank you everyone for joining.